Three. Good morning, everyone. Thank you for joining. We wanted to bring a special message again at this point in time from Paul Malloy. So with that, we'll jump right into it. I give you Paul Malloy.
Thank you, Jason. My name is Paul Malloy, and I'm an alcoholic. I, first of all, want to wish everybody a happy Thanksgiving, a happy and safe Thanksgiving. I think Oxford House has done a remarkable job in dealing with the whole business of COVID-19 virus. There have been, since last March, 237 folks in the Oxford House family who have contracted the virus. And among those 237, there have been 3 deaths, 1 in New Mexico, 2 in the state of Washington. I think that everyone within the Oxford House family feels sad about the fact that a number of us have gotten COVID and that 3 have died as a result. But we also should feel proud because more than 34,000 people have lived in Oxford House during that period of time. And so it really is something that each of us has done a good job of. We have lived together in one of the 3,000 Oxford houses that are spread across the country. And we've dealt with the problem of COVID by being safe. We have used masks when we congregated together. Other folks have set up a situation where quarantine is possible. The single room is given to the person with COVID. Other people bring food and take care of the person as they would any sick relative. Now, as we approach this Thanksgiving, we have to be careful not to let our guard down. We need to continue to do the stuff we've been doing. Stay safe, stay 6 feet apart, wash our hands a lot. If we're going to be close together, make sure we've got masks. When we go out to work or when we go out for various necessities, limit the number of times we have to go out. And when we go out, be safe because the folks we live with don't want us needlessly bringing the virus home. I think that as we look forward, all of us can have some joy in knowing that there are now 3 vaccines that have met the efficacy standards, will soon be approved by the FDA, and by next March, most of us probably will have had an opportunity to get vaccinated. This is remarkable. It's part of the reason that we are thankful this Thanksgiving. And then for each of us in Oxford House, there's a special reason to be thankful. And that is that finally we've come to terms with the terrible addiction, whether it be to alcohol or to other drugs. And we have found a place where we can heal. Where not only can we heal and become well, but we can begin a recovery process that goes on forever. The Oxford House notion of recovery without relapse is one that we've been doing now for 45 years. And for 45 years, thousands of people have gone through Oxford House and successfully changed behavior so they became comfortable in long-term recovery. That's something each of you should be proud of. We also need to be proud of the fact that we have more than 206 outreach workers and staff that are the Johnny Appleseeds of Oxford House, that are spreading the concept around the country so that other alcoholics and drug addicts can enjoy what those of us who found ourselves lucky enough to be in an Oxford House have enjoyed. That is an opportunity to get well and to stay well. That's no mean feat. And this year, even though COVID has been there as a huge cloud over the whole country, those folks in Oxford House have managed to get more than 200 new houses going. More than 200 new houses with an average of 8.2 people per house. I've always thought I'm glad I'm not that 0.2 person, but it means that we're able to live together as a family, and we're able to be disciplined enough so that we have kept each other, for the most part, safe from contracting this virus. Everybody, as we approach this Thanksgiving, keep your guard up, keep safe, and be thankful. Be thankful that you did not have a drink of alcohol today, didn't have to have a fix. Be thankful that you have either survived COVID or you didn't contract COVID. And be appreciative that in each house, each of the 3,000 Oxford houses around the country, there is a happiness of being able to share our lives with each other. Many folks don't have that. Many of us, before we came to Oxford House, were on the street, had no place to live, or were living in a car, or weren't even living. We're just barely existing, either with a needle in our arms or a drink in our hand. We staggered from one disaster to another. Then somehow, through the grace of God, we ended up in Oxford House. We ended up in recovery. And most of us are going to take advantage of that. The numbers of how many people are thrown out of an Oxford House because of relapse continue to be about 20%. That's not good. It would be nice if it were 1% instead of 20%. But 20% is about the best odds you've got anywhere, any program, anything going. And so this year, we're thankful. And we look forward to Thanksgiving with gratitude for our own recovery, gratitude for the health of Oxford House, gratitude that vaccines are just around the corner. When those vaccines are approved, which will be within 2 weeks, there'll be a pecking order as to who gets what when. There'll be a mass distribution system, so local Walgreens, CVS's, everybody else is going to be available to get the vaccine. And that vaccine will take care of this virus if enough of us get it. And I hope that all of us in Oxford House can set an example for everybody else. And when our turn comes, we'll be the first in line. I say our turn because there'll be a pecking order of healthcare workers, then old folks. I may be able to squeeze into that group, and then the rest of us. And finally, we can say that's one problem we don't have to deal with. But our basic problem is how to become happy and comfortable without the use of booze and drugs. Everyone in Oxford House has done a remarkable job. I tallied up the numbers of folks who have been successful in Oxford House since it started 45 years ago. Do you know it's over 560,000 people? That's a lot of people. Matter of fact, I'm from Vermont originally. That's more than the whole population of Vermont. And they wandered through an Oxford House, learned how to be comfortable in sobriety, and avoided relapse. So to everyone, have a happy and safe Thanksgiving. Remember, wear the mask when you should, wash your hands often, and stay out of each other's face so you don't spread the disease. Happy Thanksgiving.
Thank you, Paul. Thank you, everyone, and have a happy Thanksgiving.